Doctor, can you hear?
Hello.
Hello, can you hear us?
Yeah, sure.
Wow, you're welcome.
Thank you very much.
All
Happy to
right.
meet you guys.
Yeah, we're happy to host you and we're happy to have this session today with you. I'll just introduce myself briefly. Um, and welcome our viewers. We hope you have an exciting and informative time with us. I'm Ajoke Adebisi, and I warmly welcome everybody to this session on strengthening health systems in Africa when it comes to non-communicable diseases. And I'm Ajoke Adebisi, like I said earlier, and I'm a public health practitioner and an adolescent and child health specialist. I'm also a volunteer with Engage Africa Foundation, and I'm happy to moderate this session today. My co-moderator is...
I'm Michee Nshimayesu. Hi everyone, once again welcome to the Engage Africa Foundation Festival 2023. I'm a global health equity promoter and public policy research volunteer with Engage Africa Foundation. My pleasure to moderate this session about the contribution of research and innovation for strengthening the health system in continent to address the burden of NCDs. Nice to meet you, Doctor.
Yeah, nice to meet you. I'll briefly introduce our panelist, Dr. Berjo. He's deeply dedicated to improving access to safe and affordable surgical and neurosurgical care in Africa. He holds various important roles and affiliations. He's an executive member and research fellow of the Association of Future African Neurosurgeons, collaborating with aspiring neurosurgeons across the continent. He's an active participant in the World Federation of Neurosurgical Societies, Global Neurosurgery Junior Committee, engaging with prestigious global neurosurgery academic institutions. Dr. Berjo also plays a key role in Institution Cameroon, where he coordinates medical students and physicians to advance accessible surgical care and has worked with Cameroonian Ministry of Health on national surgical plans. He contributes significantly as an associate editor at the Pan-African Medical Journal, ensuring unbiased and high-quality scientific reviews. Dr. Berjo is also involved in extending mentoring early career researchers in peer review through the Cleverett Web of Science Academy. He's an educator providing lectures in neurosurgery, neurology, neuroimaging, and basic sciences to various audiences, including medical students and early career physicians and high school students. We're so pleased to have you here. We welcome you, Dr. Berjo.
Thank you very much for the warm welcoming.
Yeah. Okay, my co-moderator will give an overview of our discussion today.
Okay. Overview of our discussion. Our discussion today will be centered around the health system strengthening in Africa to address NCDs. Our focus will be on the link between research and innovation and strengthening health system in the continent to improve the prevention of NCDs and the care of those affected by NCDs. With diverse range of health system challenge and limited resources, African countries are increasingly recognizing the need of evidence-based solutions and innovative approach to address health system issues effectively. We talk about some strategies needed to achieve an improved quality of life of the African people through an adequate response system to NCDs.
All right, so I'll just start with the first question to Dr. Berjo. Can you please tell us some common challenges of the African health system, especially as it relates to non-communicable diseases prevention, control, and treatment?
Thank you very much for giving me the floor. First of all, most of the challenges, I think they are similar for both communicable and non-communicable diseases. And amongst them, you have the underutilization of resources available, Also, sometimes you have issues of anticipating flaws which can actually be predicted. We also have inequity in delivering of healthcare, and most importantly, we have limited resources to deliver quality care to those at need and at the appropriate time.
All right, thank you so much. Those are very important points you've highlighted, especially the inequity and limited resources to ensure universal health coverage in Africa. But can you just throw some light on how research and innovation can impact the effectiveness of the African health system?
Okay, nowadays, when we compare the African health system to that of Europe or America, you will see that in those areas, that is abroad, so that the healthcare system work with evidence-based. And that's one of the challenges that we have in Africa. And what I will say is this: other countries, they were in the shoes of Africa some years back, but through research, through innovations, through evidence-based, they have really improved. And I think Africa should follow the same because, they are showing that, what they are doing is working. So, but definitely one of the challenges that we have here in Africa in terms of conducting research is funding. Yeah, it's funding. So usually Africa is limited with a lot of funding and usually depend from external donors to conduct research on the continent. Now, nowadays, pertaining to surgery and neurosurgery, as you rightly mentioned, as doing an introductory statement about myself, I am an aspiring neurosurgeon, but on that way to be a neurosurgeon, I'm trying to already be an exemplary neurosurgeon, because now we are trying to try to divide ourselves into you as a surgeon providing care for your patient, you as that same surgeon educating, and you as that same surgeon providing research, because nowadays there's a need for a balance in all those three areas: practice, research, and education, so as to scale up the health system. And I think there are some prominent neurosurgeons and surgeons in Africa who are actually following this path. And I think that is kind of an innovative way to actually help to strengthen Africa's health system.
Thank you so much, sir. You talked about research and funding research to scale up the health system. And I know from your experience, you're an associate editor and a certified peer review mentor. From your experience in these fields, what are some strengths and gaps when it comes to research in the African health system?
Okay. In terms of research, I think the limitation that we have, as I mentioned earlier, is funding, and also we are sometimes limited with resources. But for example, at the Association of Future African Neurosurgeons, we have tried to bridge those limitations by establishing collaborations. Like at IFAN, we have established collaborations with Harvard, Johns Hopkins, and even the Neurology and Neurosurgery Interest Group in the United Kingdom. By so doing, we've been able to teach our fellows, methodologies to conduct research, because sometimes there are some tools that aren't accessible to us here. But through those collaborations, we've been able to actually get in touch with those tools, and at the same time also with the training and resources to train our people here in Africa. And I think there has been a great improvement in terms of publication, and especially we have tried to now involve medical students, because we've seen that medical students actually play a great role. And also medical students, they are available, they are full of new ideas, and they are the future. So now we are trying to work with medical students, train them early enough, so that by the time they are they come out from medical school, they go into specialization, they are already apt to perform that research. Because now with regards to surgery, Africa does not need a surgeon that just operates. No, Africa needs a surgeon that is able to operate in the operation theater, and as well using adequate public health intervention and research to also collaborate. Like, let's take for example, a typical neurosurgery patient. That is a patient who has a traumatic head injury, probably most of the times in Africa is following a road traffic crash. You see that patient is unattended to by non-medicalized, providers who have little or no training in medical care. Their first facility where they reach to doesn't have a CT scan or a neurosurgeon to attend to them. Also, they are transported using non-medicalized way to the closest health facility. And so you see that with all those factors which I mentioned, you see that most of the time, let's say the neurosurgeon will come in place at a later moment, and maybe the outcome will not be favorable. And the reason for this unfavorable outcome, for me, it will not be addressed by a neurosurgeon, no, but it will be addressed by a strengthened health system, and usually so that's why we are kind of encouraging specialists, medical practitioners to actually have that minimum public health training and research, so that they'll be able to contribute to the healthcare using medical and research and public health knowledge as well.
Thank you, Doctor. I love the way you have explained about research and innovation, and to also talk about affordable healthcare services. Can you please briefly talk about the link between improved research and innovation in the healthcare system and achieving safe, equitable access for timely and affordable healthcare services for NCDs as a specific focus?
Please, can you come again with the question?
Okay.
I didn't get it clearly. Thank you.
Saying, I love the way you have talked about research and innovation. So as an expert in research and also in healthcare services delivery, can you please briefly talk or give us the link between improved research and innovation in healthcare system and achieving safe, equitable, accessible, timely, and affordable healthcare services in terms of NCDs?
Okay, thank you very much. I'll talk again about the NCDs. I'll talk about surgical care. Okay. So research, innovation, I think they go together, because usually research tries to bring out new things to the public so that they can use most of the times to improve healthcare. Now, regarding inequity, over the past years, you could see some publications, let's say, conducted in Africa, but you see sometimes the first authors or majority of the authors they are not actually from Africa. But over the past years, things have changed a lot. You now see Africans actually leading research. Yeah, they're actually leading research. And for me, I think if you want to conduct research in Africa, I think the best person that will actually give you the best information, because most of the time research tries to actually, let's say, you want to compare a particular management and an outcome. So the tail end of it is to inform healthcare providers so as to know which tool is best to provide the best outcome for the patient. And someone who is actually in Africa, that is providing care in Africa, for me, I think is the best person to actually give a perspective in that regards. So you see that if we actually use innovative tools, and when we talk about innovative tool, we also talk about innovative ways of disseminating our results. I think in one of my publications where I talk about the management of outcome of myelomeningocele, we use kind of interactive way of presenting results to readers, so that they have an innovative way to actually have the result they want. Because sometimes you may present the result to the audience, but not in a way they appreciate it. So using that approach, you have a dashboard that helps you to interact. That is, you get the result that you want in real time. So moreover, also over the past years, they have kind of they have developed a lot of methodologies, new methodologies that is kind of adapted to the African context, because there are some methodologies which if borrowed out of Africa, it would kind of not be feasible to apply that here. So they have, over the past years, we've tried to actually, do the research in the African context so that our results are actually unbiased and can be easily applied without fear, and we are sure that this will actually help to improve the outcome of our patients who have non-communicable diseases.
Okay. Let's focus on health system only in Africa, and see the contribution of research and innovation for strengthening our health system in Africa. From your perspective, what is the link from your experience as a researcher and also healthcare delivery agent? What is the link, close link between strengthening health system in Africa and also improving our research and innovation?
Okay. The health system is actually divided into 6 domains. So there's workforce, service delivery, infrastructure, information management, governance, and finance. And each of these 6 domains actually have a great fact. It's so important to actually manage a health system. Now, let's say, talking about a study where we did a health policy analysis in Cameroon to identify opportunities for surgery, obstetrics, trauma, anesthesia care, because Cameroon is kind of developing the NSWAPs. So, but to develop those, you need the adequate information to be sure that what you are doing is the right thing. And the only feasible way for you to have that information that will guide you on how to develop a particular policy document is research. It's actually conducting a research to actually know what are the strengths, what are the limitations, what are the things which are lacking, who are the actors, like where are we supposed to actually go in so that we achieve what we think is best with regards to our goals. I don't know if that answers your question.
Yeah, right, Dr. Thank you.
All right. Thank you, Dr. Berjo. When we're talking about research, you talked about some collaborations with international schools or organizations. I just want to ask this: what's the state of the African health system when it comes to intersectoral collaboration and public-private partnership in research and innovation to improve NCD's services? Like, what's the state of the African health system?
From my own point of view, Africa depends a lot on external help and even funding. And sometimes the result that we'll have, for me, it will be like, if compared to us in Africa funding for our studies, doing our research, managing our system ourselves, I think we'll actually perform better. Like, it's true in Africa, the resources are limited, but there are many ways, many proven ways to improve on that. Like, I'll talk about a very simple one, pertaining to neurosurgical care, which is one of the commonly unaddressed non-communicable diseases in Africa. So, given the underrepresentation in the health system domain in terms of neurosurgical care, you will see that it will be much easier for us to have what we call regionalization of care. Like, for example, when we come, let's say, to West Africa, we must not have, let's say, a center, let's say, for like a center that is like kind of specialized in treating brain cancer. We might just if there's kind of a union in Africa, you can have like a particular or maybe some particular countries which actually have a particular center to address a particular health condition. Like let's say I talk about brain cancer. Let's say here in West Africa, you can also let's say Nigeria should establish a center like everybody from West Africa that has a kind of brain cancer should actually go there. By so doing, you see that despite our limited resources, we'll be able to have at least all of the care needed in Africa, and that can be achieved working together. Like for me, that will actually give us a better advantage compared to establishing external collaboration with non-African institutions. But nevertheless, it's not like I'll kind of discourage those collaborations. What I'll instead encourage is to, if there's any collaboration, Africans should learn from them. Learn, because most of the times when you usually read the memorandum of understanding, you see that the external funders or educators usually come, they have that as main aim to educate us so that tomorrow we actually become leaders. And I think Africa should follow that. Thank you.
All right.
Thank you, Doctor. Well done for a great question. Let's ask, as an expert in surgical care services and also in research, the improvement of primary health care can help reduce the burden of NCDs. So how specifically primary health care improvement can contribute for reduce of NCDs in Africa?
Okay, thank you very much. I'll still talk about, one of our contributions to research. I think there's this service which is kind of underrepresented. Pre-hospital care is a little bit neglected by many people. Pre-hospital care, because there are many. If you check well, I'll talk about trauma. If you take well, if you reflect about trauma, you see that there are many people who have trauma that they don't even have time to reach the hospital for the primary health care which you're mentioning. So developing the pre-hospital care environment or the pre-hospital sector will actually help a lot to improve on the outcome and the management for such. So, and a very effective way of doing those is actually by having innovative strategies, such as recently, I think it should be in Israel, they talked about ambulance with a motorbike that is actually able to reach areas which cannot be reached or which may take time to be reached by ambulances, bus ambulance services.
Okay, you will continue keeping me saying about innovation and research, because you are giving us an opinions or insight based scientific. That's why I keep saying you are in research and innovation. So let's talk about innovation from your opinion. What can you say about innovation, especially when it comes to primary health care in Africa?
Thank you very much. I think Africa, at least, we have improved a little bit in terms of primary health care. For example, before you couldn't see, but now you have what we call mobile. You have mobile hospitals, which are actually ambulances which are equipped to provide the primary health care to individuals in need, especially in remote areas. You now have areas which in the past they were kind of inaccessible, but now they are kind of inaccessible now. They are kind of accessible now, because now you have a kind of satellite. You have satellite centers who actually helped to actually receive patients early enough before, and if a kind of first aid is delivered before they reach the appropriate hospital. And at those satellite centers, the person that is there, the care provider who is there actually knows, is kind of well trained in such a way that he or she knows where to refer the patient. So in globally, you see that primary healthcare has kind of moved from the hospital to the community. And also, you now have in some areas, you now have the integration of community healthcare workers in the primary healthcare system. What I mean by this is now there are some areas in Africa, I think even in India, whereby primary healthcare workers are trained. Yeah, they are trained in such a way that they are able to handle certain pathologies. Like that is the first aid of it, or the primary care, even at home or in the community. Before now, they actually bring the patient to the hospital. And sometimes in Africa, there's this, we have, if you check well, Africa in the past, there was this fear to reach the hospital. Yeah, there was this fear. But lately, everybody who is sick rushes to the hospital. It's true, it's not so in all areas, but in many areas it's so. And you see that sometimes when those who actually sick in the first instance, non-medical care, but at a certain point that when they see that it's not the best, they actually come to the hospital. So it simply means that there have been over the past years, there have been good strategies, especially in terms of communication, which have been, especially through social media. Social media has played a great role to inform the populations of the importance of seeking healthcare in the appropriate facility. And also, it has also kind of educate people, because now you see that in Africa, many patients, when they come to the hospital, most of the time they have a clue about what they are having. They're more informed, and they actually come to the healthcare providers to seek the best care available.
All right. Okay. Can you tell us some strategies to improve research and innovation in the African health system?
Okay. Thank you very much. That's an excellent question. So in terms of research, to improve on research, one of the first things is to involve medical students. Medical students should be trained at an early phase of their career. What I mean is, research should be introduced in the curriculum of training. I'm not just talking about medical students, other fields, other health sciences fields, even nursing, laboratory sciences, pharmacy, etc. Research should be like a part of the training curriculum, because in many African countries that's not the case. So I think it should be part that will actually help to train those at an early stage of their career. Another important tool that will help is for Africa to organize. I think many people are doing that already. That has been done. Like now, there's this avenue of like online platforms which actually serve to train people, and for free. So I think I will encourage many other countries to do same by actually organizing webinars, short courses to actually train younger ones, or those who don't have prior experience with research. Another tool is for our leaders in Africa to look for a way to sponsor research. Yeah.
All right. So we lost Dr. Berjo. I think he has some technical issues. But we are so grateful for his responses. We're so grateful for holding this session, and I believe this session will impact knowledge and close some gaps when it comes to research and innovation, when it comes to non-communicable diseases services by the African health system. And we hope this session will go a long way to improve quality of lives of Africans. At EAF, we're so concerned about having these conversations to improve quality of health and healthcare services in Africa.
Yeah, I believe this technical insight from our doctor will be useful for strengthening health system and recognition of research, development and innovation in Africa in order to improve healthcare delivery and address NCDs. Our doctor, even if you are not here, thank you so much for your time. We really appreciate your scientific insight.
Thank you so much. Thank you to our viewers and hope to see you some other time. Bye-bye.
Thank you.